Okay, so Sculptra is it's a biostimulating product. Totally different from filler. It's not going to add immediate volume. It's going to stimulate collagen over a course of weeks and months. It's made of a product called PLLA, polyl-lactic acid, which is what's found in dissolvable sutures. So we've been using them in medicine for many years. It's basically been crushed up into a powder. It gets reconstituted with some cell water and local anaesthetic, and when that's shaken together and placed into the face, you get a controlled inflammatory response from the skin. And what that will end up doing is it creates a wound healing, and through that we start developing new collagen, mainly type 1 collagen, and that offers a kind of natural volumization to the face, and also increases the collagen levels in the skin itself, so you get more of a Sculptra glow. So your skin improves alongside just like a full-on volumization as well. So it's an amazing product if you're looking for something alternative to filler. Okay, so traditional filling that we're using these days contains hyaluronic acid. So that's more of a gel-like substance, will give us immediate volumization. You inject it into the face, the lips, and anywhere that you're looking for added volume, and you'll see it straight away. That's a kind of soft product that can also be dissolved as well if there was ever any problems with it. The difference with Sculptra is it's more of a permanent product, so in that it's not dissolvable, and it also doesn't offer immediate volumization, as I said. The Sculptra particles itself, they do actually get broken down by the body over a course of about 4 months, so there's generally no Sculptra remaining after that time. What is remaining is the collagen deposition that had been made around those particles that have been injected into the face, and that is what you're left with when you get the volume rather than the product itself. I would say that there has been a big shift over the last few years from kind of filler face wanting to be just, adding more and more and more volume. There's a lot of people who are wanting to go for more natural results. I don't think that fillers are wrong. I love using fillers, and I still do use them all day, every day. But there are those who just have a fear of looking overfilled, over puffy, and you can sometimes get a little bit of a sort of swollen look with fillers if it's been used too much. The good thing about something like Sculptra is you're not totally changing people's features. You're just giving them back potentially what they had sort of 5-10 years ago. You're improving skin quality overall. You're just allowing them to kind of look like themselves but better. It's a much more subtle change, and that's what people are really liking. They're not wanting to go for something overly dramatic, so it's quite a good sort of entry level treatment if you're wanting to have some sort of improvement to your face, but you're not wanting to go for maybe something as extreme as filler. I would use Sculptra is great for like all age groups. I maybe wouldn't use it on your 20-year-old. I think that they're way too young to really be going for any aesthetic treatment, but that's a conversation for another day. Say you're going into your 30s, you're starting to see a little bit of change in the skin quality, your collagen levels are starting to drop, you're wanting to keep that glow to your face, it's maybe starting to look a bit dull, you're smiling, you're maybe starting to notice puny crepey lines on your face. That's a brilliant time to start using Sculptra just for that great skin improvement. As you age, you're going more into your 40s, your 50s, even into your 60s, you are losing a lot more volume. Your temples are starting to hollow, your cheeks are starting to drop, and you're seeing more nasolabial folds and marionette lines. Sculptra at that point is great to give a little bit more of a lifted effect. It's not a facelift. We've got to be honest with that. If you are at the stage where your skin has really dropped inside, that everything is falling down, we are going to have to start talking about a surgical route. But if we're looking for some subtle lifting, as it's kind of holding the structures back and giving that volume in areas that you've lost it, then it's amazing for that. And that's why it's good. You can use it along your journey from early on right up until into your 50s, 60s, even 70s. But you have to be realistic about what sort of result you're going to get from this. I mean, nothing in this world is without risks, and the risks with Sculptra Mainly due to the method of injection, you're always going to have potential a bit of swelling, bruising and tenderness in the first few days. That is normal. We will go through all the aftercare instructions as to how to manage these sorts of risks. Other than that, the one risk that probably a lot of people are concerned about when it comes to Sculptra is they've heard of things called nodules or long-lasting lumps and bumps. These are very, very rare, and they were more of a historic occurrence when the dilution of Sculptra was a little bit too tight, a little bit too concentrated, and what would happen is the product could clump in certain areas and collagen would grow around it and end up having isolated nodules maybe pound in the face. It feels like a little pea-sized lump. This is very unlikely to occur with our modern dilution methods and with the massaging that we recommend afterwards, just to ensure that the product is evenly distributed and you don't end up having any of these clumps. We also ensure that it's not injected into areas where you're at more of a risk of getting clumping of the product, so around the mouth, around the eyes and potentially in the neck. These are kind of tighter areas where the muscles can sort of contract and hold the product in areas that we don't want it to be. And normally when we talk about fillers, we say don't touch your face, leave everything alone. Sculptra is the complete opposite. What we're looking for is some massage 5 times a day for 5 minutes for 5 days. So it's a 5-bag-5 rule. You get a lovely little pack to take away with my gua sha tool to help you with your massage, and a little egg timer to make sure you're doing it in the right amount of time. But actually a lot of patients love it. They really enjoy I think just being taking part in their journey, and a lot of them enjoy the feeling of massaging their face as well, and they find that they can feel their skin getting smoother as they do it as well. For those who are impatient, unfortunately you're not going to see results straight away. I say this is a marathon, not a sprint. The same as you go to the gym, you do one day of lifting weights, you're not going to have big biceps by the end of that. So you need to know that you're on this for the long haul. With most patients, we look at doing 3 or possibly 4 sessions of Sculptra with 6 weeks in between, which seems like a long time. But you're going to have much more long-lasting results. If we take a photo of you on day 1, and then we take another one 6 months after treatment, the results change is going to be massive. You don't see it when you're looking at yourself every day, so it's hard to see that change. But that's why we like using the aura analysis machine, because then it can actually pinpoint exactly where you're seeing those improvements. But the fact that it takes a long time, it's nice and it's gradual because it's your own body regenerating. You're not adding something artificial that's just staying in there. It's your tissues that are creating that lift and that volume, and that will last for up to 2 years. I think the main one that people worry about, as I said before, is about the nodules. They are such a low risk, and we can never say no risk, but it all comes down to the injector's technique and their experience, and also just following your aftercare as well. There has been a bit in the press recently about plastic surgeons saying that they don't recommend getting treatments like Sculptra if you're considering a facelift, because it can make it much more difficult for them to retract the tissues because of that added collagen that's been developed. Now, if you were looking to be getting a facelift in the next 6 months, then of course we wouldn't be recommending doing any kind of treatment like this, particularly if you're needing something like facelift. But not everybody's, we don't all have that money in our bank, and not everybody really wants to go under the surgeon's knife as well. So if surgery isn't really the route that you're looking down, then something like Sculptra is perfect for you because it's going to maintain your good for much longer. But even if you were thinking about a facelift, if it's not going to be within the next 2 years, then absolutely you can go ahead with this if it's just going to give you that improvement for a bit longer and your skin quality is going to look better, rather than straight away resorting to the surgeon's knife. And to be honest, I think if they're a good plastic surgeon, they're going to be able to manage it regardless of whether you've had treatment or not.